Please, guys, if you can hear me on the Facebook Live, please, guys, let me know if I'm audible there. Thank you. Okay. Okay, guys, just editors. Okay. Okay, guys, I'm sharing the screen right now. You guys share screen. Okay, guys, please, guys, if you can see my screen, let me know, please, guys. Okay. Hey, guys, please, guys, if you can see my screen, let me know, please, guys. I'm not sure why I cannot see your comments. I think still. Hmm. Hey guys, I think it's going too slow, my connection. We have a storm right now. I can hear the storm outside. That could be the reason. I hope guys you can hear me as well. We have a very huge storm outside, and maybe that's why the connection not the best. At least from my side, because let me just to close this one and do it again. Just escape. Yeah, I think. Okay, guys, now I start to see your comments on the Facebook, and I see Dr. Maria there, and most of you guys on the Facebook right now on Zoom as well. So, guys, I would love to check on you before I start the session. So, guys, how's every one of you guys? How you doing? By the way, I have posted for the mock, and the mock will be mainly from the last 5 sessions. I will be attaching the links for the last 5 sessions. So if you want to listen to them, that will be helping you. The mock will be either Sunday or Monday or Tuesday or Wednesday or Friday. So guys, I see right now that's Dr. Maria. Hi, Dr. Maria, how you going? Dr. Eshika, how you going? Dr. Nikita, how you going? Dr. Maria again. Dr. Sangeeta, how you going? Dr. Shuryanka, Dr. Rana, Dr. Natali. Thank you very much, Dr. Koshikan, Dr. Fatima, Dr. Dipali, Dr. Shashank, Dr. Rohi, Dr. Hash, Dr. Simran, Dr. Dimple, Dr. Sarah, Dr. Muhammad Sulaiman, Dr. Khalifa, and Dr. Kwaljit, Dr. Liv, Dr. Natali. Guys, I want to say hi to every one of you, but there is a big list of your names. But guys, I'm saying hi definitely to every one of you. Okay, just update the schedule right now. Dr. Gilan say, Dr. Please, I missed Thursday lecture. Can you mention that was actually about the new task? So I was explaining how to go through the new task. So it's mainly was about the plan itself. I was going through the plans for the new task, which is X-ray. Okay. By the way, guys, I'm very happy seeing you here today. I'm very happy seeing you. I know there's still time for preparation, and we just started the course somehow. And because my experience with the candidates, actually, they become active toward the end. But I'm very happy, guys, to see you active from now. And this is really very good. Okay, now, do you remember, guys, that I discussed with you the ADC question sample? They actually released in their own website. And then we found actually, do you know, guys, do you remember what did you find in these questions? If any one of you guys remember, just please, guys, try to remind me. By the way, tomorrow we may have another session if you like. I haven't decided yet. It was in the plan, but depends on your availability because I know not everyone available. So if we not get enough champions, they are available tomorrow, so we can keep on either day. Okay, I need to know how much delay happens. I think the delay is more than 20 seconds from my time from here. Dr. Shiva said hi, said yes, please. Yes, Dr. Ashika, you're right. Okay, I think there's 20 seconds delay from my side. Okay, guys, sorry guys if there is any delay, and this is again because the storm happening here. Okay, that is good then. So guys, what we found actually in the released questions, we found that there are lots of X-rays, and then one X-ray can control the whole scenario. If you're going to interpret this X-ray wrong, in this case, the management for the whole scenario can be wrong too, guys, if you remember. By the way, that was a private session. Now, I found out, so the best way in this is you really need to know how to interpret the X-rays. And then I give you, definitely there is lots of ways to tell you the interpretation. I had lots of different ways to tell you, but I chosen only today's way, because I would say this is the easiest way to understand them. Okay, keep going right now. Yes, Dr. Ashwini, it's bad weather today. And it's Halloween, right? It's Halloween today because I see lots of people celebrating Halloween in the streets. I don't know how they can enjoy the night then. Okay, let's start. Guys, can you see my slides? Yes, no? Yes, okay. There's 10. I think now it's became 10 seconds. Okay, gap. That's fine. So guys, today's session is about X-ray interpretation as you see right now. So just a simple definition. What is the X-ray interpretation? The answer is to see and to know what other cannot see. Because if I give you an easy X-ray and then the residential caries and the huge dental caries, anyone definitely can say this is dental caries. I don't think exam that much easy, by the way. Do you think guys exam that easy? They're gonna provide you with an X-ray with very clear dental caries, and then they ask you what is this, and then you're gonna say dental caries, and then you go on to pass? Definitely it's not. So as definition right now about X-ray interpretation, that's a easy, I would say this is the easy way to understand what is X-ray interpretation, is to see and know and to identify what other cannot see. That's why you're going to be unique dentist. And you are, in this case, will be the type of the dentist that ADC or Action Australia looking for. Let's start. Guys, what is this? I said to see and to know that the other cannot see and they cannot know. What is this? Not easy, right? I agree. So tell me now, can you see and know what the other cannot see and know? Styloid process, perfect. Dr. Alifea. Dr. Ray, hyoid bone, styloid process. Styloid bone, styloid process. Earring, bone, styloid process, styloid process. Styloid process, styloid process. Please, guys, everyone likes. Please, guys, look at these two names. Dr. Asna, KB. I think her name should be KVP. Do you know, guys, what is KVP? Guys, what is, guys, KVP? KVP. Yes, kilo voltage peak, right? The kilo voltage peak. True. And that's why Dr. Asna, KP, I think her name is KVP, because she's the only one has answered this question correct. And also Doctor, I have someone say earrings or something. I don't know. There was someone else said earrings. Ah, okay. Cannot tell. But someone has mentioned earrings, which I cannot see it anymore. Imagine it is not styloid process. And as Dr. Asna mentioned, please, guys, look for Dr. Asna gave her heart. Let me give her heart first. Okay. Asna KP. She said ear. So the answer is yes, Dr. Shiva. That should be you. Thank you. And even big heart for you, Dr. Shiva, too. Good. Okay. So that's, guys, an ear loop. You can see this right now. The answer is it is ear loop. Styloid process is actually more thinner than this. Styloid process, it should be more thinner than this. So that's, guys, a cartilage for the ear. Okay? I hope it's clear right now. Guys, what is this? What this, guys, by the way? Can someone, guys, say what is this? I think white color would be good. No, which color can be fine? Blue? Blue. Please, guys, interpret this. Elephant eye, right? That's elephant eyes. Very good. Easy now to know the elephant eyes, right? Or that's an orbit. That's elephant eye. That's an elephant, and that's eye. If you can see elephant eye, means like you're doing good. Now, forget now about the elephant, and let's focus on this X-ray. Guys, what this X-ray? What is white stuff in the X-ray? There's radio-opaque masses. This radio-opaque masses. Rancor eye, right? Yes. Contamination by what? Calcified structure or bone? Okay. Which structure? Calcification. On which structure? By the way, guys, the exam will be like this. Like Eagle syndromes, as you said, calcified, which is calcified stellar process. We may think about definitely more into foreign bodies. Right? Yes. Cyalolith, yes. Sometimes can be stones and some artery, like carotid artery, for example. So you must know all the stuff to pass the exam. Parotid gland inside the bone. Look, this is more peripheral artifacts. Okay. So guys, there are two things here in this X-ray. Actually, two things in this X-ray. The top part and bottom part. So you see some debris. The top part is debris, like all of this debris. Between the screen and the cassette. This part here. But the bottom part, which is this here, this is the tonsillar calcification. It's calcification, but which structure? Tonsillar. You know where is the tonsil? It's a tonsil calcification. For a dentist, once you see this, you're gonna be like, oh my God, what is this? And then definitely you will get like, oh, let's take biopsy. Definitely you don't need biopsy for these cases. Again, as I mentioned before, the X-ray interpretation is not just only to read about X-ray, but is to see and to know what other cannot see and cannot know. Now, can you please tell me what are these two lines? Let's say the black line first. What is this structure? That's a root. This is a bridge. Seems like it's metal fused or porcelain fused to metal bridge. And then there is a bottom structure. Good, external oblique ridge. I'm happy. It's an external oblique ridge. It's not a canal. The radio opaque, we say the radio opaque. Where is the black arrows? See, guys, where the black arrows? The radio opaque. A structure is external oblique ridge. Okay. What about the radio opaque structure with white arrows? The top one. By the way, guys, any of this X-ray easily, like, you know what, count 4 months from now, and you will remember this. Any one of these X-rays can be easily in exam. Once you see some of this X-ray in exam, you will remember the session. So guys, external oblique ridge and internal oblique ridge, both of them, internal on the top, external on the bottom. Guys, look at this teeth photos. What do you think is the X-ray required or the X-ray needed here in this case? Which is the X-ray required here? What type of X-ray? Is it periapical X-ray? Is it an OPG? Is it CBCT? Or is it occlusal? Is it lateral ceph? I see the answers is between periapical X-ray, but still most of the answers I see most of the answer goes toward the OPG. OPG first. Dr. Dipali, totally right. Dr. Rohi, panoramic, I think that's an OPG. Dr. Kwaljit, it's OPG. OPG, it is OPG. Dr. Kwaljit, OPG. I'm very happy. Dr. Koshikan, Dr. Asha, OPG. Simran, OPG. Yes, OPG. That's good. I'm very happy. It's OPG. Okay, guys, the first instance is OPG, right? If the question about the best X-ray or additional, if the keyword is the best or the keyword is additional or the keyword supplementary, right? So in this case, we would choose CBCT, okay? PA doesn't work in this case. The PA X-ray, not the right PA X-ray. It's not the right choice in this case. Okay, I'm happy. Yes, it's OPG, the right X-ray for this case. Guys, what do you think the treatment for tooth number? Guys, by the way, what is this tooth number first? What is this tooth number? The one with root canal treatment. To 6. Okay, I have seen to 6. To 5. There is 2-5. Premolar to 5. Dr. Fatima. Dr. Rohi to 5. Dr. Jaylan to 5, Dr. Natalie to 5. I'm happy. 2-5, okay? Wasn't 2-6, was 2-5. Now, what sort of treatment is inside? What is the treatment inside? It's not 1-3, doctor, okay? It's 2-5. What sort of treatment inside this tooth? Please, guys, give an explanation about all the treatment has been done in this tooth. All the treatment. Intracanal treatments and the coronal treatment, please. RCT, I'm very happy. Obturation, I'm happy. RCT, only RCT? Thank you, Dr. Yatri. RCT plus post. I'm happy. And the core? That's okay. It's not actually core, but yes. Epicectomy? It is pylori, but it's not an epicectomy, Dr. Rana, no. Okay, guys, so what's made inside is RCT plus post. What sort of coronal restoration, guys? So there is RCT plus post, and then coronal. What sort of coronal restoration? What material used for coronal restoration? Composite. Let's say the word plastic restoration, because it can be composite, it can be GIC. I would even say, yes, it can be either composite or GIC. It's plastic restoration. Now, do you think the obturation is it optimal? Is it optimum obturation? Or is it short restoration? Or is it long restoration? What do you think about the obturation? Short obturation, and if short, how much short it is? From the X-ray. Dr. Simran short, Dr. Fatima saying short, Dr. Dipali said short, Dr. Maria said not short, Dr. Maria mentioned not short GP, okay? Dr. Musa says GIC, yes, I agree. Yatri Tumem, I would say it is short only by 1 millimeter only. Just 1 millimeter is enough. Why? Because if you're going to check from here to that way, and then they get the pressures here. So if you extend it maybe a little bit more 1 millimeter, I think now you'll be 0.5 away from the apical constriction, right? The radiographic apex. This guy is called radiographic apex. So guys, obturation should be how far the obturation should be from the radiographic apex, guys. How far should be the obturation from the radiographic apex? That's called radiographic apex. Yes, we look at, there's a good question here. How to check? So what I check is, I look at the lamina dura, follow the lamina dura, because it's going to give me where is the apex. Apex direction, the red point is the apex. The red point, this is the apex. How do I know? From the direction of the obturation? You see how the obturation goes this way. So if you follow, it will go out from here. So how far it is? 1 millimeter short, about 1 millimeter. So now from radiographic apex, now let's say the word radiographic apex. How far should be the obturation? Anyway between 0.5, that's ideally, okay? Ideally. Anywhere between 0.5 to 1 millimeter. That's ideally. Okay, great. How far should be the obturation from the anatomical apex? From anatomical apex. How far should be the obturation from the anatomical apex? Dr. Dubali mentioned 0 mm. Dr. Mubarak mentioned 1-2 millimeter. Dr. Lev mentioned 0. Dr. Shiryanka 0. Dr. Yatri 0. Dr. Siyosh 0, 1.22. Dr. Walisha 0. Dr. Christine 0. Dr. Simran 0. So the answer is 0. The answer is 0, okay? By the way, guys, sorry, I'm looking at your okay, guys. That's, guys, the lamina dura, okay? And then the restoration, I will make it in yellow. This is the Gata Persia, ends until here. The apex should be that one, the red. This is the apex. If you look at this, you will find the best way to stop this obturation. It should be at the orange level. Let's say this level, which is about, there is a shortage about 0.5 to 1 millimeter shortage. Okay? So you're right, it should be 0. Now, how far should be the obturation from the major constrictor? Guys, the question can come with different versions. The question exam can be like this way. The question may ask you how far the obturation from the major, they give you X-ray like this and ask you how far the obturation from the major constrictor. What is the answer? Okay, that's good. 0.5 millimeter. So guys, let's learn this, okay? Let's learn it. Major constrictor is equal to radiographic apex. Minor constrictor equal to anatomical apex. Easy now, guys, this information? I hope it's clear, guys, to you right now. So if you're using any of these words or any of these terms, you'll be able, guys, to identify. Okay, good then. Now, if you got this case in the clinic, based on X-ray, what is your management in this case? What will be your management, guys? Thank you, Dr. Vanke, very much. Yes. Major is radiographic. Yes. Major is radiographic. Yes. Minor constriction is anatomical. That's true. Guys, if you get this case in your clinic, what are you going to do in this case? Apart from you really need a crown, because I believe you still need a crown here. You need to place a crown here, okay? Apart from the crown, what is your management in this case? No, no, not to live, no. Dr. Tanvir, in for the apical constriction, sorry, for the radiographic apex and the major constrictor, it will be 0.5 millimeter. Imagine to this, ideally 0.5 millimeter to 1 millimeter, ideally, but it can be imagine it can be 0.5 millimeter to 3 millimeter. Imagine. Okay, but for minor constrictor or the anatomical apex, it should be 0. I hope guys is clear right now. You're very good guys, yes? In this case, what you need to do is you only need to just follow up. This case, don't need to disturb anything, just to follow up. Why do we need to follow up? Because when I look at the apex here, there is no any changes happen in the lamina dura and the periodontal membrane. There is no changes. There is no widening of the periodontal membrane. Oh, okay, guys, let me just do this on the side there. Okay, because when I look at the X-ray here, you will find there is no any changes has happened in the lamina dura. No changes has happened to the periodontal membrane. There is no widening of periodontal membrane. No changes has happened to the bone. So in this case means like everything going fine and the body can actually withstand this treatment. So the treatment being done is RCT plus post. The management or treatment of this case, you just only need to follow up. Follow up. Why? Because there is no any soft tissue or bone changes has happened around the roots. Guys, what's the treatment of this tooth? What is the treatment for this tooth? Okay, so now I see different answer for this question or this X-ray. I see Dr. Simran says RCT. Dr. Fatima mentioned diet palpicapin. Dr. Walija, RCT. Guys, what is the most conservative treatment for this tooth? RCT and crown, RCT, 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 frank exposure here, okay. That palpicapin, RCT, RCT. RCT since distal pulp horn is obliterated. GIC, RCT, palpicapin, RCT, that palpicapin. Okay, I'm happy with this. Botomy, okay, I'm happy. So the answer actually is the treatment will be pulpal treatment. Pulpal treatment based on the situation. It could be RCT, which most popularly it's RCT. Most probably RCT. Okay. Guys, what is black areas? This, what sort of this black area? What is this? Let me remove it. This and this. Let me check your answer. Cervical burnout, artifacts, cervical burnout, shadow, cervical burnout, shadow, cervical burnout. Dr. Alifea, Dr. Bavana. Okay, cervical burnout. Very good. So, guys, everyone has mentioned cervical burnout. You're really great. Okay, good job. Easy, guys, the interpretation, right? Do you think so? And by the way, those are the things actually need for the exam. Now, guys, can you tell me, this is a stage, right? So tell me, what is the stage? Periodontal stage in this case. What is the periodontal staging for this case? Is it stage 1 or not? You cannot define the stage. You cannot determine the stage. Or is it stage 2 or not enough information to tell about the stage? Or stage 3 or stage 4 or stage 5 or stage 6? Stage 3, stage 3, stage 3, Dr. Lakshmi, stage 3, Dr. Simran, bone loss, Dr. Anj, stage 3, if I pronounce your name right, Dr. Simran, question mark, was stage 4, Dr. Shada, guys, don't tell me stage 3, stage 4. Give me one stage. Tell me, I cannot determine. If you have a question, examine that way. And the question is about 1, the first option is a stage 1. 2, the option B, stage 2. Option C, stage 3. Option D, stage 4. Option E cannot, let's say, not enough information to determine the specific stage. So which one of these, A or B or C or D or E? E, not enough information for a specific stage. Dr. Fatima 3, Dr. Tanvir 3, Dr. Bhavana 4 question mark, Dr. Sarah 3, Dr. Muhammad 3, Dr. Shashank stage 3, sense for cash involvement, Dr. Rohi stage 3, Dr. Sayeda, she is very good. She say, how to differentiate between what cervical pain out occurs? I will answer this question, doctor. Dr. Shiva, she said 3 Cora. Dr. Greshma, stage 4. Dr. Rana, stage 3. Stage 3. Dr. Koshikan, Dr. Nawarin, stage 3. Dr. Lev, stage 4, but we need OPG. Thank you very much, Dr. Siush. Everyone, guys, has mentioned stage 4, I will give you heart. Dr. Siush, I give you heart. Dr. Lev, I will give you heart. Everyone mentioned stage 4. Dr. Greshma, I will give you heart. If you said 3 and 4, I will not give you heart, but I may give you like. This stage, guys, is stage 4. Why stage 4? Exactly same explanation that that was who? Yes, Dr. Suyash. Dr. Suyash mentioned more than 50% of bone loss is stage 4. Thank you very much. Easy concept, Dr. Aisha. Hi, Dr. Aisha. Stage 4, I like it. Dr. Aisha, stage 4. I'm happy. Dr. Afrin, stage 4. Guys, how do you know stage 4? Again, 40%. Where about the bone level? The bone level is here. This is more than 50% of the roots. That it takes you straight away to be stage 4, straight away. You don't need any more information. Let me just get this way. Okay, guys, where about the bone level? Bone level is here. More than half of the roots. Right? Means, like you see this root, for example, you see this root, so half of the root. So it means straight away takes you to stage 4. Straight away. Again, you're gonna get similar X-ray in exam, and then they ask you what stage. And then you keep asking, oh my God, how can I decide on the staging from X-ray? Yes, that's a way we actually do. Guys, is that clear so far? You see, most of you said E echo. Dr. Shashank, Dr. Simran, Dr. Alifia, Dr. Sharada. No, guys, it's not E echo. It is actually 4. That's it. Okay. Guys, is it guys clear so far what we discuss about? Very good. I'm happy. Keep going. So, guys, the answer is stage 4. So, this stage, it is stage 4. Okay. Let's get with the second slide or the next slide. Guys, what is this? What this roots? It looks like roots, right? Like a tree roots. It's not an artifact. Yes, it's static. It's static, guys. It is static. Okay? Electrostatic. That's not artifact. It's not an artifact. Okay. Can you tell me another era has happened in this X-ray, in this OPG? Look at it and tell me there is another issue. It happens in humid atmosphere, yes. And sometimes when you take the film from the cassette quickly, when you take the film from the cassette quickly, it can happen as well. Okay, so what has happened here is I believe if you look at this X-ray, you will find that there is double image. This X-ray has been taken twice. Look, guys, about this double image. Everything double. Look at this, look at that. Look, this root, crown, 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 crown. Here. That's what's double image. Okay. So guys, it's electrostatics, okay? It's an electrostatics. Now, what is this? What is number A? Sorry, what is A? What is B? A, guys, is A is ear ring, right? That's an ear ring. A alpha. What about B? B is ghost image. A is A is for ear ring, and the B, it's a ghost image of the ear ring. How to differentiate, guys? Can you give me the characters of, give me the features and the characters of the ghost image? How do you know it? How to identify it? Okay, let's identify it. Ghost image will have one. It should be taken, it should take the same shape as a source. You see, it's the same shape. Two, it will be blurry. This is sharp, this is blurry. Three, at a higher level. This is this level, the ghost is higher. Then big in size. This small, this bigger. Easy now, guys? How to know the ghost image? And definitely on the opposite side. Clear now, guys, so far? Very good. So I think there are five to six. Let me just say them again. Okay, seems like it's clear, right? Okay. That's, guys, this is the reason, right, why the ghost image is happening. It's a metal. The panoramic X-ray rotate around your head. So because the X-ray will be scattered all around, and then the LPG will collect the image into pieces. So now it will collect the original plus the image out of it. It should be blurry, as you see right now. That's the original. This is original. And this is a ghost image. Will be blurry, opposite sides, higher level, bigger in size, magnified. And definitely take the same shape. Guys, what do you think the error in this X-ray? But anyway, yes, there's an error in this X-ray. What's the error? The most visible, clear error. Glasses, right? Yes, Dr. Natali, glasses. True? Yes. They shouldn't have that glasses. I agree. Guys, what is the error here? What is this structure? This one has lots of landmarks. Let's go with every landmark individually. What is this structure? The arrow which is in red color. It's a tongue. It's a tongue person. It's a tongue person. Okay? No, it's a tongue person, guys. Okay? Nose is too. It will be far from here. This is a center. It's a tongue person. Okay. Let's look at another structure. What about this arrow? This radiolucency. What is this? Airfield, okay. Shadow of what? Mandibular canal, no. I mean this one. Aerospace of what? I agree, but of what? Why this aerospace has happened? Like this aerospace. No, no. Very close. I see some of you very close. It's not the nasal cavity. It's not. It's not. Ah, thank you. Thank you, Dr. Sangita. I see your answer right now. Tongue not placed in the palate. Thank you. I will give you heart then. Please, guys, everyone give heart to Dr. Sangita. She is the first one mentioned it. Tongue has been placed on the palate. If the tongue has been placed on the palate, you will not see this. Guys, by the way, this is the ADC exam, by the way. If you don't know this stuff, and then you're gonna get it for the first time, you may get shocked. Okay, guys? So please pay attention to the stuff. We give you the study materials for X-ray. It has all the stuff in it. All the stuff. In the study materials, we give it to you. Either in Louisiana notes, right? Or in other notes, we give it to you. Okay. So answer is the tongue. That's the guy's tongue shadow, tongue space. It's an area space has happened because of the tongue, because the tongue hasn't been placed on the palate. So guys, that was tongue piercing, by the way, okay? This tongue piercing. What is this, guys? What is this? What is this structure? Okay, I'm waiting. Dr. Sibia, yes, Dr. Sibia? Yes, Dr. Rana? Titanium plates, that's okay. It's a plate, Dr. Shrada. Yes, you're right. Titanium plate, yes. Many plate, that's okay. Good then. I would say it does make sense. Guys, what is this? What is structure? Lead apron, yes. The shark fin. I love this, Dr. Suresh. It's a shark fin. Why the shark fin has happened? Because the lid apron, okay? It's a lid apron. That's a lid, guys. Very good. Guys, what is the error in this X-ray? The smiley face. Why there's a smiley face? Why this patient is having smiley? Smiley, and also you see the vertebrae is too close. The vertebrae is too close too. Like it is given in the X-ray itself. Chin down, yes. Yes, chin down. I'm happy with this. The chin down. That's why he's happy. Okay, so he's happy because the chin down. And why, guys, the vertebrae is showing? Because the vertebrae shouldn't be showing. Because the shoulder is inside the machine. When exactly the shoulder will be inside the machine? When the patient bites too much forward. So again, guys, what's the error? Look, guys, the vertebrae. Look, guys, vertebrae were like the X-ray machine, the OPG machine has actually registered both the jaws plus the vertebrae. Normally, we're only looking for jaws. Why this has happened? Why this vertebrae being captured as well? Why the vertebrae showing? That because the patient has bit whereabouts too far forward. So the shoulder has been taken when the OPG machine was rotating. What about this? You cannot see any vertebrae at all. Not even one vertebrae. And then you will find the anterior teeth, especially the lower anterior, smaller in size. All the anterior smaller in size. So guys, what has happened in this? By the way, after you answer, tell me please guys what this lesion. What this lesion after you answer this question. If you tell me what this lesion, I'll be very happy. Mental foramen, mandibular foramen. I see answers, guys, as Dr. Lakshmi, Dr. Shashank, mental foramen, Dr. Lakshmi, mental foramen, Dr. Saral, mental foramen, Dr. Vipa, periapical axis, Dr. Mubarak, patients backwards. Yes, for overall. Lateral fossa, far backwards, mental foramen, granuloma, mental foramen, apical granuloma, mental foramen. What is the question? About the, oh, okay, guys, did I show, oh, okay, this guy's reducency, guys. Guys, can you see the reducency on the apex? Reducency around the apex. Yes, reducency around the apex. Around tooth number 3, 4. No, not 1. It's a periapical abscess or granuloma or cyst. Which on, or that is normal. Is it granuloma or abscess or cyst? Or J-shaped reducency as Dr. Nikita mentioned. So I see answers between Dr. Nikita Karias, Dr. Arya periapical abscess, Dr. Fatima granuloma, Dr. Shashank granuloma, Dr. Rana abscess, Dr. Jasprit abscess, no defined border, so it is abscess, abscess. Okay, guys, let's now differentiate between abscess, cyst, and granuloma, okay? Let's do this right now. Okay, the shape is very diffused. Look at this. It takes the tooth from here all the way until here. This is an abscess. What if it was the granuloma? What if we're granuloma? Granuloma will be hanging from the roots. Like this. That's a granuloma. What about cyst? Cyst, it will look like granuloma, but bigger in size. Plus, there is mostly, there is radio big zone. This is cyst. So now this X-ray was actually about abscess. Anyway, all this X-ray in this group was actually the patient has been backward. That's why we cannot see this. Okay, what is this structure, guys? This radio big structure, all the way from top to down. This one. Very good. This is cervical spine. Cervical spine, right? Yes. Why cervical spine? Because the patient was what? Slumped. The patient was slumped, right? Very good. You know what? We just explained this one right now. What do you think, guys? This lesion. You see how it's round like a ball? And the hanging mostly of the roots. This one hanging and this one hanging. Mainly from the root. And looks more like round, like a ball. Ball hanging from the root. A ball hanging from the root. And then the margin is well defined. Not irregular. Mean the body has good resistance to make it. If your answer here is granuloma, I'll be very happy. Thank you, granuloma. Everyone mentioned granuloma. I'm very happy. Means you got the points in the last slide. I'm very happy. Guys, what has happened to this patient, guys? Why this angry patient face shown here? This patient is angry. Flat. Occlusal is flat. It's reversed back, like angry. So when you have an angry patient, why is this? This guys has happened because chin is up. Chin up. The patient has his chin up. The head backward. The head has moved backward or chin's up. Very good. Patient chin's up. What about his smiley face? A smiley face. Why the smiley face has happened? If the angry face was chins up, so the angry face means chins the way around, chins down, right? Very good. Chins down, right? What has happened to this patient? Do you think the mandible is broken? What has happened? Patient has hiccups, right? The patient got hiccups. A quick sudden movement like hiccups, okay? That's a quick sudden movement. Yes. Okay, guys. The mock exam again, just to say this. Please, guys, comment when exactly one of the mock exam is a Sunday or whatever. And then I believe we can stop here. I have more x-rays need to discuss. I have all these x-rays need to be discussed. But I think that can be discussed, guys, in the next session then. We've already been there for more than 1 hour and a half. It is good for Friday, after long day Friday. Okay, guys? If you really want to have session tomorrow, we can do the rest out of it, or we can discuss about the mock. Please, guys, let me know. Okay, guys, thank you. I hope, guys, you like the session, and the session actually has helped you to get some points today. As I said again, X-ray is actually the one of the most important, or actually the most important uh, individual subject you must know about, because you see right now we discussed about dental caries, we discussed about oral medicine, oral pathology, we discussed about perio cases, we discussed about X-ray itself, right? That's why it is very important to guys know about this. Slammed, Dr. Sir, slammed mean the neck not straight. The neck is not straight. Thank you, Dr. Fatima, for saying this. I really appreciate it very much. Dr. Shriyanka, thank you very much, Dr. Shriyanka. Tomorrow, please, tomorrow session, okay. I will put a post again right now after I finish this class. And then if we have about 100 champions available tomorrow, not busy, so we can do it. Have please Friday to you everyone as well. Thank you. Thank you very much, Dr. Lakshmi. Thank you, Dr. Luciano. Thank you, Dr. Muhammad, very much. Thank you, Dr. Ashwini. We enjoying this session. It's my pleasure, Dr. Pin Nisa. Dr. Suresha, very interesting session. I'm very happy, Dr. Suresha, to hear this. Thank you very much, Dr. Alifia. Thank you, Dr. Arya. Thank you, Dr. Poonam. Thank you, Dr. Shiva, very much. Very useful session. I'm very happy to hear this, Dr. Teresa. Thanks very much. Tomorrow, Dr. Musa, okay. Do tomorrow. Dr. Shiva, amazing session. Thank you very much. It's an interesting class, Dr. Bedo. Thank you. Thank you very much, Dr. Sarah. Thank you very much, Dr. Veb, as well. How differentiate between whether it is cervical burnout or caries? Cervical burnout, it will be more into a band, 1 to 2 millimeter band. It does involve more than one tooth, maybe 2 to 3 teeth. and it happens just below the contact, above the roots, below the contact. And the shadow is there. It is actually gray shadow, not very black, but more into grayish. Dr. Bidu, can you show me, please, lamina, dura, and periodontal membrane? Okay, let me do this for, you know what? I think tomorrow, if we discuss again about it, you will find lots of pre-apical X-rays with both things. Okay. Thank you very much, Dr. Musa. Thank you very much. Dr. Sayeda, say answer this question, Dr. Sayeda. Say third topic for for mock, 5 topics. I will send the links for the 5 topics in a post right now. Now, guys, I'm going to do 2 posts. One, if you're interested to take the session tomorrow. Two, a post with all the links that you really need to go through for the mock exam. Thank you, Dr. Naveen, very much. Thank you, Dr. Bui. I missed most of this interesting lecture. Dr. Naveen, sorry, I'm hopefully Facebook will not remove it. So you can actually listen to this session again. Thank you, Dr. Asna, very much. I'm very happy to hear that was good session. Thank you, Dr. Sipia. Thank you very much, Dr. Simran. I'm happy to hear it was a nice session. Thank you, Dr. Swandray, Dr. Afrin, Dr. Kushi Khan. Thanks for making radiology interesting, Dr. Bido. Good night. Thank you very much, Dr. Kushi Khan, and thanks very much for attending the session and to let me know it was interesting. Thank you, Dr. Marwas. It is the same doctor, Dr. Bido. Can you show me, please, Ramna? Yes. I think tomorrow, Dr. Fatima, we can do this. Doctor, can you tell different? Yeah, I answered this question, Dr. Kainet. It was the best class, doctor. Thank you, Dr. Mubarak. It's Mubaraka. It's my pleasure. Dr. Said, I answered this question already, right? Thank you, Dr. Jaspreet. It was great class. Thank you very much. Even I knew many new things. Thank you. Thank you, Dr. Mubaraka, very much. Dr. Lakshmi, can we please have more of this X-ray session, Dr. Bedo? Definitely, Dr. Lakshmi. Definitely, because I definitely support you and I hear you in this request because as I told you before, when I looked through the paper, I found really lots of tricky questions was coming by X-ray. A question with X-ray make the whole scenario tricky. It may look as an easy scenario, easy question, but as a fact, it is really hard. How to differentiate stage 3 and stage 4 in X-ray? Dr. Kilvenda, we decided in stage 4 because half of the bone has been lost more than how oh sorry because the bone the alveolar bone has lost more than half of the root level. That's why it's stage 4. Stage 3 will be only 1/3 and less than half of the bone around the half root. The bone around half root. Doctor, can we see the anatomical position of apex? Yes, anatomical. Yeah, it's called apical X. It's called radiographic apex. Then how differentiate obturation of 1 millimeter between anatomical and radiograph? Anatomical is the apical construction, which is the best way to end and stop your obturation at. That's anatomical. Radiographic is different. The difference between both is zero point 0.5 to 1 millimeter, sometimes even more than this. Dr. Sayed, a very informative session, Dr. Bido. You are the best. Oh, thank you very much, Dr. Sayed, for saying this. I really appreciate it. Okay, thanks a lot, Sayed. Please start your prosonics class. We're right of the time here. We have done the prosonic class already in our private sessions, but we can do this again. Thank you, Dr. Anish, very much. Thank you, Dr. Adam Bedo part 2. Thank you, ICDS. ICDS session 2, okay. We can do ICDS session 2. We already did the ICDS session 2. Please double check it. Dr. Bedo, where can I find your other lectures? As I enrolled the course 2 months late. That's okay, Dr. Asha. You're not late at all because actually the main course has started only a week ago, 2 weeks ago. It's not 2 months. It was just warming up stage. And whatever you missed from the session, even, it is either recorded or we're going to revise it again. We're going to repeat it again, okay? You mentioned zero point 0.5 to 1 millimeter. What was that, please? This says how you should stop and end your obturation far from the radiographic apex. Okay, this is how the obturation. So obturation should end at the anatomical apex. Obturation should ends at or should end at the anatomical apex. How far the anatomical apex of radiographic apex is 0.5 to 1 millimeter, the same distance of the minor constriction, which is the anatomical apex, to the major constriction, which is the radiographic apex. Okay? Okay, guys, I believe I answered all questions here right now. So when will you take cleft palate? Every time I put it in my poll, and the people they choose something differently, I will put it in the poll again and see if anyone going to choose it to be next time. Okay. Thank you very much, guys. I was very happy. I will do two posts right now for I will do two posts right now. One for the links you need to study for the mock, and the second for tomorrow's session. If there is 100 they can attend tomorrow's session with the short notes, so we can do it. Okay, thank you very much, guys. Have a great night, every one of you. Thank you very much. Bye bye. Bye.